Welcome to the Stretch and Mobilization series. Today we are working on our pelvis area as well as just our lower body in general. So what I'll be using today, as always, I've got a foam roller. If you just have a ball, a larger ball handy, that is totally fine. Then I have my 2 mobilization balls. Again, this one is sort of the size of a tennis ball, but definitely much further. And then I have my little medium-sized ball, and this gets into some more broad areas. And always I like to keep a towel roll handy just in case I need to have some support. Let's get started on our backs and let's just kind of decompress a little bit. And it's up to you. We're just going to do some 10 breaths here to get started. And I'm going to actually start with my foam roller under my legs here. And this is going to allow my hip flexors to shorten on me and relax a little bit. So up to you how you want to get started, but we're just going to do some nice 10 kind of cleansing breaths just to get us in the right mindset to start the stretching and mobilizing and relaxation. So get yourself comfortable. And let's do 10 breaths here. So inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale. Exhale, inhale, and exhale. Inhale, and exhale. Inhale, and exhale. And inhale, and exhale. And inhale and exhale. Good job. Hopefully you're a little bit more relaxed now. And I want to start out our first exercise with a new technique. And you may or may not be familiar with it, but it's called skin rolling. And it's really awesome to release adhesions in the muscle tissue, and it also helps to separate our level of connective tissue, the fascia, from the muscles. So sometimes when we have a little bit restricted range of motion, these 2 areas can kind of become adhered together and can result in lack of flexibility for some people. So before we get started on that, I'm going to demonstrate. I'm going to come up close to the camera and I'm going to demonstrate the foam rolling. And since I can only do it on my one hand to demonstrate here, you want to pick up the tissue that you are working on, and you are just going to kind of roll or walk your fingers around the skin. So you're kind of picking, lifting, and rolling. And it should feel a little bit uncomfortable. And it is one consistent movement. So you're not just going lift, squeeze, and then pinch, lift, squeeze. It is a continuous roll. And that will really get some great results in the tissue. You can go in a cross direction with the tissue. You can go in the same direction as the tissue. You can go diagonal. working it in multiple different angles will help get you a greater release. So I want to start with this actually on our hip flexor muscles, and it is really going to be great because the hip flexors just take a beating. And another FYI with the skin rolling is it's a really great way to break up scar tissue. And depending on the healing of your C-section scar, skin rolling is amazing for, I would probably say maybe 6 weeks post-baby. You could probably start, depending on your individual situation, 6 to 8 weeks, you could start doing some of these skin rolling techniques. Of course, if it's uncomfortable, then hold off on that a little bit. But let's get back onto our backs here, and make sure you've got something under your legs here. So be it your foam roller, a ball, a larger towel roll. What this will do is just kind of allow us to have more skin to grab on with our hip flexor, because when your leg is super straight, then you really can't try to grab, you really can't grab very much. So let's just spend a couple moments here, and you can play around with the technique of skin rolling, and you really want to find your hip bones and feel around for some tissue that you can grab around the hip bones, and just kind of pick up the skin and start rolling away. Of course, this is better and easier when you are in the buck, but this is a family-friendly video. So go and work on here for a couple moments. Remember, try and get into a different angle or different direction. Really just kind of pick up, lift, and roll that skin. And you'll kind of, after some practice, develop a technique. Now, if you found an area that feels a little restricted, while you're holding the skin and lifting the skin, you can bow the skin. This is a more advanced technique, but what you can do is you can take your hands and make a C out of the tissue. You can make an S out of the tissue. You can make a U, whatever letters. But by further manipulating the tissue, you'll find you'll get a greater release. So play around with that. Make sure you get to the other, work on the other side, and feel free to, follow this along and see where it leads you. You may find that you find an area that's a little bit more sensitive and tender on the outside of the body versus the inside. So definitely go slow and see what your body needs. But you will find that if you consistently do this, you will definitely gain some mobility. So since we've started with our hip flexors and they're already nice and warm, I'm gonna grab my foam roller and I'm gonna lay on top of it. And I want to, again, feel for the bones on the front of the hips that stick forward. And also I want you to take your hands and imagine that you're putting your hands, if you do have pockets, then that's great, putting your hands in your pocket. And this is kind of the region that I want to focus on for our foam rolling for this session. And we can even get a little bit more specific and grab a ball. So let's get started. I'm gonna start on my right hip flexor and just going to put my body weight on there, using my arms to take up some of the slack. And using your opposite leg, you can also take and further fine-tune how much weight and pressure is on this area. So just rolling up and down, loosening up. And you may feel it already so much looser from just starting with that skin rolling. Skin rolling brings a lot of local blood flow, so the area might feel warm and ready to work. Good job. And while we're here on the foam roller, I'm going to actually turn onto my side, and I'm actually going to get kind of the side of my hips here, nice and slow, working on to kind of the top of the glutes here. We can really just kind of get all these great areas. And of course, as always, if you find an area that needs some extra loving, if things are coming up for you, then definitely hang out there. Pause the video if you need to. I'm gonna slowly rotate myself around and start doing some more glute max here. Getting into that bigger tissue. Good job. Again, if you need to hold it in a certain position, you can hold and then you can twist around it. That'll help loosen things up a little bit more. So definitely go for that. Awesome. And then I'm going to sit up on the roller here. And this takes a little bit of manipulation. You may want to adjust your roller a little bit, but I'm actually going to get into the hamstring and where the hamstring attaches right at the bottom of the glute. So try and give you a better visual here. This is actually, if you have a ball, you may be getting an even more defined and accurate little massage. So you can play around with that too. I don't know about you, but I do find that my hamstrings and glutes from standing tend to get pretty tight. So let's take some time here. And then I'm gonna have you kind of bring it down to the hamstrings. So you may need to take your body weight off the ground to get a good roll. If you need more pressure, taking your opposite foot, crossing it over the leg you're working on, that'll give you much more body weight and pressure on that hamstring. Again, if you find a nice spot, especially usually with the hamstrings, there's three main spots. They're, where it attaches at the back of the knee, then where it kind of attaches right under the butt, and then in the middle of the muscle belly itself. That middle part can get pretty tight. So make sure that you're working all of those areas. Good job. Awesome. Now I'm going to flip back down onto my belly, and I do want to work a little bit of my quad, and once we're done working the quad, then I'm just going to go ahead and switch to the other leg, and we're going to just repeat the same thing on the opposite side. So just a couple minutes on my quad here. And that feels really good on the quad, just above the knee. And especially if you have some tight ligaments that pull on your kneecap, which is fairly common, rolling just above the kneecap is glorious. You can do this with the weight on your roller just above the knee, or you can rotate a little bit so you get a little bit more on the inside of that area above the knee, or you can rotate the opposite direction so you can get more of the outside of the knee. Believe me, I can spend all day doing this. This is just always a treat. Alrighty, now that we've gotten into the quad a little bit, I'm gonna switch over and we're just going to repeat what we did on the opposite side. So going into that hip flexor, actually gonna rotate around this way so we get a better visual. But again, we want that front of the hip, kind of where our pockets would be. And really, take the time and notice the difference between your right and left. Sometimes it's a huge difference. And of course, rotate around as much as you need to. Stick with your sweet spots that you find. And before we roll over and continue what we did before, since we're here, I'm gonna work on this quad a little bit. And remember, focus kind of just above the knee, little different directions there. Yeah, it's amazing what you find. All right. All right, now coming back to the side here, a little bit more on the glute. Awesome. Really allowing that roller to get in there. Good job. Bringing it over to kind of the glute max area. Good job. Again, if you find a spot and if you need to pause this, if I'm getting too ahead of you, then definitely do so. This is really kind of for you, your benefit. Now I'm going to come up a little more seated and really kind of get onto that glute a little bit better and into that hamstring upper attachment. This is kind of where that butt fold is when you're standing up. And I've always had the talent of being able to put at least 6 pencils under my butt fold there. So perhaps this can be a challenge for everyone to do the butt fold pencil test. That has been a prerequisite with some glute programs I've tried in the past, and I think it's a way for them to show you how lame your glutes are. All right, and then just kind of work into the hamstring a little bit more. You can work into the belly of the hamstring. There you go. Good work. Again, use that opposite leg if you need to get more pressure, if you need to go a little deeper, that is the way to do it. All right, how's that going for everybody? Good stuff. All right, so now that we are a little looser, I would like us to do what I like to call the Superman stretch. And this would be if Superman were lunging, I guess. And what it does is it's really going to open up our hip flexors and really get them to relax. So come into a lunge position, and you want your hands on either side of your foot. And depending on your flexibility, just work with what you have here. And what we're gonna do is we're really gonna focus on the hip flexor, which is kind of this front of the hip area. And we're gonna kind of alternate. So we're gonna focus on this stretch. Then we're going to lift the back knee off the ground into a glute contraction, okay? And we're just gonna alternate. We're gonna do 5 total. And if you need some support, you can keep your hands on the ground. You can even use a chair. You can even use your foam roller is a nice way to assist this. So we're going to stretch and squeeze. So stretch and squeeze the glutes, stretch the front of the hip, squeeze the glute. That's 2. Stretch and squeeze, stretch and squeeze, stretch and squeeze, stretch and squeeze. All right, that might have been a little bit more of a workout than a stretch, but believe me, once you get up and you start walking again, you will feel amazing. So next you'll want to switch sides. Come into your lunge position. Figure out where you want to be. Kind of feel around on your hip flexor. And we're going to stretch and squeeze for 5. So stretch and squeeze and stretch and squeeze and stretch and squeeze and stretch and squeeze and stretch and squeeze. Good job. So hopefully you should feel pretty loose right now. Our next stretch, if you can get into this, and it might be a little bit of a challenge, you could also use a roller, a pillow, or a ball. And I'm gonna, it's called the frog stretch, and I'm trying to, maybe I'll come at this, I'm gonna work on my angle here for you so you can understand. So just basically get yourself into some frog legs and lower yourself down as much as you can. And this will really help to open up kind of the groin area, for lack of a better word. And if you're someone that is suffering from prolapse or imbalancement in your pelvic floor pressure, you may have to take this one a little bit slow and not go as deep. Really just depends on what you're working with, and depends on how recently you've had a vaginal C-section or vaginal delivery. If that has been you, this area may also be a little too sensitive to do this stretch. So just kind of be wary of this. But it's a really good way to get that space open between the thighs there, just to loosen things up. A couple deep breaths here. Relax. Good job. All right. Coming into seated here. So we did a really good job. We're going to end now with some fine-tune rolling, and it's up to you whether you want to use the pressure of the wall. You can do this standing, you can do this seated, you can do this laying down. But I really want us to get into the glutes today. So I'm going to use my medium ball, and I am going to be brave, and I'm going to sit on it. You can also put your butt up against the wall and do that from that angle. So let's see if you can get the visual here. And it does help if you have your knee bent a little bit, you might be able to get a little deeper. You can also turn your leg out a little bit. You can get to some of the deeper structures of the glutes and the hips. And then just roll around, find your little sit bone there, and you can do circles around your sit bone. Find that sweet spot. And once you've found it, you can dig in a little deeper. Good job. And up to you if you want to bring this more to the side. And you can even bring this up a little bit higher, right at the top of the hip bones. But really just kind of do your best and enjoy. Get a nice massage out of this. And once you've got all these down, I mean, you really can't go wrong with these. You can do these when you're sitting down playing with the kids while you're watching TV. You don't really need to do them with my guidance because your body is really the guide here. So, see what you're working with today, and and then spend the time that you need on those areas that are giving you a hard time. So just kind of observe how, I do like to position my leg a little bit different. That helps you get into like different cracks and crevices, and helps you to find out those spots that you never knew were there. Good job. Awesome. And I'm gonna turn over a little bit to the side, get some of my glute medius here. You can definitely learn a lot about anatomy by rolling. Because ultimately, you find a spot that you're curious about. And you're like, wow, what muscle is that? That is amazing. So if you are kind of the curious type, always good to, once you find a muscle that you find is like constantly nagging, do some research on it, figure out, hey, why is it like this? Maybe it's because you're holding yourself a certain way, you're trained a certain way. So the body is totally amazing, and I always encourage you guys to do some research on, your body and the muscles of your body. All right, so that was our stretch and mobilization exercises for today. I hope you enjoyed. Again, let's just end with some relaxation here. I'm gonna get back onto the ground with my roller. And let's do some nice, yummy breaths. And hopefully this is a time where the day is over, everyone is sleeping, the house is quiet, Or hopefully you can just, mentally take yourself to, a calming place, whatever that is for you. Maybe that's a beach, maybe that's just, a quiet nook where you're looking out the window at some mountains. Or maybe it's, it's snow or rain. A nice rainy day always gets me so relaxed. I want to have a cup of tea and just kind of cozy up by a nice chair by the window. So whatever your happy place is, let's focus on being there. Could be in a nice, serene forest in the evening where all you can hear are the wind just rustling the leaves. Or maybe a stream or a brook is a nice happy place for you. But wherever that is, just use these last few minutes to just kind of go there, take yourself there. And while you're there, take some nice deep inhales and exhale. And inhale, just feel your body melting to the ground. And take another deep inhale and exhale. Inhale and exhale. And inhale and exhale. Inhale, take the time to observe the muscles that we stretched out today. And exhale. And inhale, I hope they feel much better. And exhale. And inhale. And exhale. And inhale. And exhale. And exhale one long, big inhale. Holding your breath at the top. And just let everything go. I hope this stretch was amazing for you. Hopefully when you get up and walk around, you feel lighter. You feel pressure off your back, pressure off your hips and your pelvis, and you almost feel like you're floating. Thanks so much for joining me, and I look forward to seeing you soon. Take as much time as you need in this position.